It's a pleasure to be with you, and it's so nice to see proactive, a force for good to save our profession and to get us out of the rut that we're in. I think I hit the wrong thing. You know, we are here to learn about what each other is doing. And I'm an ear, nose, and throat doctor. My practice is a little bit different because it's a bit of a hybrid. And I'm still of the mindset that a complete third-party free practice is the way to go, but I'm in the middle of transitioning to it and using everything in my arsenal to make sure that we get paid appropriately in a timely fashion, and it's all about the patient-doctor relationship. Nothing gets in the way of that in my practice. So let's talk about a little bit of the background of where we came from. We're in the midst of a shift in our healthcare system. There's been a rise in the power of the insurance companies with their capitation and their managed care. Their encroachment into our offices is just unseemly, to put it mildly. And there's been an increase in the number and the expansion of the scope of practice for the mid-level providers. And the doctor-patient relationship is being pitted against the insurance companies. And we've been made to be the fall guy. You know, we're the face of medicine. But we're not the true cost of healthcare. It's actually the hospitals, you guys all know, insurance companies, big pharma, and it's time now that we take our power back. I trained in New York. Dr. Huntoon was kind enough to give my bio. And one of the things that ended when I opened my practice was the things that I used to do. I trained for head and neck, for ear surgery, for complicated cases. And the first thing that left when I opened private practice were those cases because of reimbursement. That's a shame. I trained for 6 years, and I'm not doing maybe a quarter less of what I was doing before because I can't afford to. And that's bad for the patient. And I'm sure you out there, if you're in private practice, I'm sure there are things that you trained to do that you no longer do because it's not cost efficient. I opened my practice in 2001, and I left a huge 40-person group where it was a mill. You had to get patients in, get them out. You weren't producing enough. You weren't performing enough procedures. And that's the antithesis of what I think medicine should be. So I happily left. And when I opened Peachtree Ear, Nose, and Throat Center, I decided I'm not going to play the game. I didn't want to see 1,000 patients a day. I didn't want to do mid-levels. I wanted a boutique practice, and I wanted to do something that I loved, that I was put on this earth to do, as all of you are. And I decided not to compromise. Since I opened my practice, you know we've been under siege, so now there's only 30% of independent practices out there. There's been a direct correlation with the advent or the power of the hospital buying up practices and the loss of independent doctors. And we've been devalued. Unfortunately, I think we've been silent, and we've allowed everybody to define us instead of us defining ourselves. And it's all about nomenclature and the use of words, just like George Orwell. If we're providers, we're no longer special. Now we have doctors who are entering the profession who aren't physicians. And we've allowed all of this to just kind of unfold while we're kind of playing catch-up. And it used what makes us us against us. We really care about what we do. We love what we do. We care about the patient. We care about taking care of the patient. We care about self-sacrifice. And it's not about the money. And because of that, we went along. If you have to work harder, then so be it. If you have to see more patients, then you do it. If you have to hire people to run your practice with you, nurse practitioners, physician assistants, then you did it. But I think we've reached a point that you can't do any more. Then right now you're in a position where everybody's treading on us or riding our coattails, if you want to put it that way. Everybody's a doctor all of a sudden, but they're not physicians. And now it's time for us to literally reframe this. It's all about the doctor-patient relationship. It's been a systematic attack on our autonomy. Third party has used the government against us, and we've been muzzled in a lot of ways. And for the most part, hospitals have become adversaries. I practice medicine as an independent doctor. I haven't sold my practice. I have no interest in selling my practice. I am on staff for the local hospital as a consultant, not as an active physician. I don't see their ER patients. And that's been my way of carving out my autonomy in this system. So, we talked a bit about how the system is unfolded with increased patient volume, with the satisfaction. There's been a lot of pressure on being able to run your business as a small business owner. You have to wear two hats. I'm paying for the light bill and the internet just as much as I'm running, making sure the router's working when the computer goes down and seeing patients. You're doing everything. And what we need to do is make sure people know who we are. We need to begin to define ourselves once again. The nursing profession has done a wonderful job of outsourcing and advertising, and they now have the mantle of the caring side of the healthcare profession. How did we let that happen, guys? I don't even know how that happened, but the nurse is the one who's now in the forefront caring for the patient, and we're somehow just out there like an ancillary arm of this healthcare system. But more importantly, they're trying to frame us as the people who are causing the cost to go up. So with the advent of Obamacare, we took a lot of hits, but I did a talk maybe 2 or 3 years ago, and I said, Obamacare is the best thing that ever happened to us. And everybody gasped, like, oh my God, could you say something like that? Because it's so horrible. Because it's reached such a disgusting portion, or it's swung so far that we can't keep the status quo. It's not working. We've lost all of our colleagues, well, not all, but some of our colleagues to hospitals. They've sold their practices. They've become just, mouthpieces for the hospital system. They can't even speak up without fear of peer review, and all sorts of other things that they've stuck on as maintenance of certification, et cetera. And we have a chance now. We're at a crossroads. We need to make an informed choice, something that works for us. Nothing works for everybody. That's why there's all of us up here, because we've all done it slightly different. And it may not work for you, but it works for me, and vice versa. So I see this as an opportunity to rebuild the medical healthcare system. That's why I wrote the book. It's all about us and our patients, not the insurance companies, not the government. And a couple of speakers before said the magic word. It's all about educating the patient. We're in a position now where we're in the perfect stand, where the patients have seen Obamacare roll out. It didn't do what it said it was going to do. It didn't decrease prices. It didn't help you access your doctor. It cost you more. You get less. They get it now. Now is the time to make the change into a third-party free practice or a hybrid practice, or somehow go out and outreach to the people who work and are able and willing and looking for us to help be their partner and their advocate. As I said before, it's our time. We need to reframe what defines us as physicians in our healthcare system. And if we don't, it'll be defined for us. And if we don't make a change, our future, I think, will be to sacrifice the Hippocratic Oath and patient advocacy and our autonomy. And it's only going to lead to more compliance. So standing around hoping for the government to help us, sorry, it's a little soapboxy, but it's true. We have the power. They can't work without us. They can't run the system without us, no matter how many other mid-levels they want to try to foist on us as doctors. We have the most training. We know the most about the physiology, the anatomy, and we know the most about helping and curing and healing our patients. As I said, we're being defined. Medicine is becoming, or has been told that it's a right and not a service. And it's not a right, because if it is, then someone will get to define our value, and we really don't want that to happen. So how I changed my practice was to examine my payer mix. And I looked at every insurance that I took, and those that didn't pay me, or gave me a hard time, or made me not work for the interests of my patients, I got rid of them. Medicaid and Medicare were the first to go. Humana, you name it, I just dropped them like hot potatoes. And I basically have about 4 commercial insurance plans. The ones that actually, as fair as they can be, they're reasonable. And I tried to renegotiate parts of the contract so that I could get more for what I thought my services were worth. If you don't ask, you won't get. Now the most recent thing that's come online, and this is what I mean about the pendulum. I know that most big cities have hospital systems. Here in Atlanta, we have like 3. And it's all about market share for these guys. So what they did is they pack-manned hospitals, but they didn't have enough doctors to staff them. Now they're coming and literally coming to the office and saying, we'll make a deal with you. We're not going to tell you what to do, who to see, how to manage your patients, but we want you to be a source for our outpatient system. And that's like 250,000 people who need an ENT in Atlanta. Everybody else is tied into a healthcare system, but since I'm independent, I'm not. And so I really thought this was going to happen. Just stand your ground. Make your barrier, stay behind it, and eventually it'll come to you because the system's broken, it doesn't work. And this is exactly what's happening for my practice. So now I'm in a position where I'm a clinical partner, but I'm not part of their system. They can't tell me how to write a prescription, how many patients to see, what my protocol is. They have no power on that at all. And I can step away from it and not have to have any kind of restriction or covenant, which is what we kind of all want, I think. I talked about getting out of Medicare and the fact that I have a hybrid practice. And I think we talked a lot before about concierge versus direct pay. Mine is kind of a hybrid of both. I have a single pay or a monthly payment plan for patients to pay, and it offers ENT services that I offer in my office, whether that be hearing tests, endoscopic examinations, etc. I own the equipment, I can control my time. Makes sense to me, and it makes great sense to the patient. We also dispense medication, so we're able to keep the price low from that standpoint. One thing that we didn't talk about is medical cost sharing, which is a little different model. These are the Christian sharing ministries. There are about 4 of them. They started back in 1981, and they've grown dramatically. There's about 400,000 members throughout the country right now, and growing, thanks to Obamacare, actually. And this is another alternative. It's a consortium of self-pay patients who join pool their resources together, and they pay for each other's healthcare needs. Now, what changes this from a strict concierge is that they can pay for big-ticket items. If you get admitted to the hospital, if you have to have a major operation, all of that's covered by the membership. And that makes it slightly different, so you can stay out of the third-party system and actually be able to afford it. I've had office members, because we joined as part of one of them, my office staff, I put them in it, and they have a supplemental policy through AFLAC, and we're actually getting paid now to stay healthy. And we've used it. Back surgery, somebody just got admitted to the hospital, and they had nothing to worry about financially. There was no restriction on having to be within a certain plan or use a certain doctor. That's really what patients are looking for, and that's something you might want to consider becoming a member of one of these panels, because if you're a physician in a direct primary care practice, you can actually use one of the cost-sharing models to offer services, or people who have cost-sharing models can use your services, better way to put it. The medical cost sharing is not insurance. It was always exempt from the ACA. It is the power of the self-pay patient. And since there are no networks, the patient's able to go outside of the typical services that it's offered. The one that I joined actually has, you can go out of the country for medical tourism. You can do holistic care and alternative treatment. So it's really based on membership. Whatever the members want, those services get added, and that's all about individual power, in my opinion. It can also be used as a supplemental plan instead of AARP for Medicare patients. For the physicians, what this offers is peace of mind. You're not going to have to beg for a pre-cert. You're not going to have to wonder whether you're going to get paid. Some of the patients pay up front. Others, once they meet their shared amount, the entity, the company will actually pay you directly. So there's not this pulling rugs on people where you get the pre-cert, you do the service, and then they deny you after the fact. It doesn't exist in this type of system. Nothing's good for everybody. So for some people who can't afford anything, they may not work for them. But that's what this is about. This is what this whole organization is about. It's about the power of the individual and not having this mindset that one size fits all. Other companies that you can use as an independent doctor are Sergio.com. That's for surgeons who want to list their prices and get paid directly that way. There's MediBid. I'm sure you've heard of it. You can bid for, put your services online and the price and have people and bid against other doctors for it. And MedRetreat is the organization that offers medical tourism, but it's based in the United States. So you don't actually have, your facility can actually become one of the places that MedRetreat uses for their patients. People don't necessarily want to travel anymore, but if in the United States there's a place that you know what the cost of something is and you're willing to travel, you will use MedRetreat, and it's really a nice, nice weapon that you can use and to, expand your practice, to get everybody to know that you exist, and they do all the work for you. They find the patients, and it's actually free. So that's pretty much it. Thank you for listening. I think it's all about us getting our word out there. I do it through radio and TV, but you guys all have the same platform. And social media is actually really powerful. Have your patients write reviews online. I get, I would say 90% of my patients from people who've read about my services and my office online. And that's really one of the best things, it's word of mouth. So I want to thank you for your time. I look forward to answering your questions.